Yang Berbahagia, Tan Sri Dr. Jemilah Mahmood, Special Advisor on Public Health to the Prime Minister, Dato, ladies and gentlemen. It's my honor and pleasure to welcome here Yang Berbahagia Tan Sri Dr. Jemilah Mahmood to our forum today. Tan Sri Dr. Jemilah has been in the forefront of the battle against COVID and is one of our national heroes together with Tan Sri Dr. Noor Hisham in leading the fight against COVID. So it is very useful for us to be able to hear from her and to relate it to how at the workplace we can better manage people and the work environment on preventive measures on public health care. And I think this would be a very important aspect of human resource management that human resource managers needs to take into account. I'm delighted that Tan Sri Dr. Jemilah has taken the Prime Minister's invitation to return home to Malaysia to serve the country from a very nice position that she had in Geneva, enjoying Geneva, the lifestyle in Geneva, to leave that and to return to Malaysia, I think is a sacrifice that she has made for the country. So we welcome home Tan Sri Dr. Jemilah. We welcome you in your new position as Special Advisor to the Prime Minister on Public Health, and hope that you'll be able to continue to help shape our continued response to the battle against COVID. As many people think, COVID is not going to go away soon. It will be with us for a little while, more to come. And your leadership, I think, will play a very important role in shaping the future response. So without any further ado, may I now hand the floor over, and please welcome Yang Berbahagia Tan Sri Dr. Jemilah Mahmood.
Assalamualaikum and good morning, everyone. Thank you so much, Yang Berbahagia Tan Sri Michael. It's always a pleasure to spend time with you, and often we meet each other in very strange places and circumstances, but it's good to be home. The only problem about coming home is I put on 2 kilograms, so I'm now on a strict vegetarian diet. So today I thought, first of all, Dr. Nelson, your speech was really inspiring, and you could feel it came from the heart. And it's always good to tell stories, right? But when I was invited, I was wondering, so what do I speak to HR experts? Although my whole life evolves around people, and in the last, I think, 15 years, it's been a lot about management, more than 20 years actually, about managing people. But in the circumstances of COVID-19, the human resource perspectives are so pertinent, and there are so many experts in the room who already addressed this. So I thought maybe I'll talk a little bit about, what we will look at in terms of, let me see if I work this. It's not changing over there?
Yes, yeah.
Yeah. So what I'd like to do today is take you a little bit beyond COVID, but also talk to you about the biggest challenges that have brought us here, and then how it impacts people and also human resources. So I'd like to speak a little bit about, planetary boundaries and health, something that perhaps you have not heard of, so I can sound a little bit more clever than you. And what has COVID-19 highlighted in this aspect, and how do we adapt to a new and sustainable framework? The second thing, of course, is the toll on human resources, which is what you're here for, and how have different groups been impacted. And I also want to talk about opportunities. I think it's not all doom and gloom, and that we need to take advantage of the challenge that has been presented to us to do things better. If you go back to I will go back to the first slide. I deliberately called it the next normal because the title given to me was the new normal. And honestly, what is the new normal? It's a shifting normality, and certainly whatever we thought was normal in the past is really not good for us. So my ask is for us to start thinking a bit differently, that context changes so rapidly. We always know that the only thing constant about change is change, right? And that the pace of change that the world is experiencing right now is so rapid that often just when you think you got the answers, the context changes and you need to change. So I think, having that adaptability and the openness to change is very important. And therefore, I like the term the next normal, because we'll be having many next normals in the future. So let's talk a little bit about, beyond COVID-19 and planetary boundaries and health. So how is health produced? You may think that, health is because of, health systems are really the hospital, the medical clinics, the doctors, the nurses, the support workers. And we always think about it that our health is created inside some kind of medical setup. The reality is that particular aspect only contributes about 20% of health creation, right? And improvement. More than half of the pie, as you can see, is actually attributable to social and environmental factors. A huge chunk of it is human behavior. And you've seen this now, right? The Ministry of Health, under the DG's leadership, has really done an excellent job. We've been able to flatten the curve quite quickly. We've been able to bring the R0, or the reproductive number, now below. We're now about 1. We had it at 0.3 before, but because people didn't behave, therefore the numbers rise. So human behavior is extremely important. And just a very small portion of it, genetics. And we talk about social and environmental factors. It's also about our own habits. Do we smoke? Do we eat healthily? Do we exercise? So all these things contribute to general health. So we have, as a country, developed quite rapidly, and that's very important. We have a vision to be a developed country. But many of our social and economic development of the planet. So with the gains in healthy life, the life expectancy that we have achieved, we've reduced mortality for many diseases, but we've also created different forms of pollution, as you can see from the chart on the screen. We have destabilized the climate. We have altered a lot of the natural flows in the ecosystem. And our consumption patterns have been altered so much over the past century that all of these are contributing to the global burden of disease. For a period of about 200 years, we have really increased our water use. We're overusing our water resources. They say that maybe the next World War will be one that will be about water, no longer about land. When people say, oh, COVID is unprecedented, I cringe. It's not unprecedented. It is not a black swan event. We saw it coming. We all saw this coming because there was so many pre-COVID signs and symptoms, right? We saw the environmental degradation that was going on. We had H1N1, we had SARS, we had MERS-CoV. All this didn't arise out of nothing. As a humanitarian, but in my background, for the last 10, 15 years, we've been talking about preparedness, pandemic preparedness. The first ever preparedness training that the World Food Programme did after H1N1 was actually in Malaysia, and I was helping them to run it when I was in Malaysia in Kuala Kubu Baru, and it was called P2LX. At that time, this is 2006, we were already thinking about how the next pandemic will happen and what do we do. So the question of a pandemic is actually not a question of if, it's a question of when, and the next pandemic, and the next pandemic, and the next pandemic. So there is an estimate that about 25% of the diseases on the planet will emanate from environmental factors. Toxic pollution, air pollution, high diversity loss. We've also seen that planetary health damage is about 50,000 deaths per year due to climate change. And this is a huge underestimate. Around 150 million people are at risk for climate-sensitive malaria in the years to come. And there's about $30 billion, probably an underestimate as well, in terms of health costs annually due to the impact of climate change. So coronavirus didn't come from nowhere. The fact that environmental degradation was so rampant, the margins between animals and humans become smaller, and our habits as well. So much so that about two out of 3 diseases that we face will be zoonotic, means from animal to human transmission. So let me introduce you something called planetary boundaries. So we need to start thinking about a safe, operating safe space for humanity. And this is what we call the Planetary Boundaries Framework. A bunch of scientists came together and the Stockholm Resilience Center developed a concept and a framework. And it identified that there are 9 planetary boundaries that we should look at. And these are, basically, you can have the slides later, but these are some of them, basically looking at your biosphere integrity, biochemical flows, and so forth. You can measure nitrogen, phosphorus, and so forth in the environment. If these boundaries are violated, then the planet will be less conducive or even unconducive for human survival, for the sustainability and the living of our civilization. Unfortunately, as you can see, I have put up 3 country comparisons. If I didn't show you this before and I asked randomly in this room, which country do you think violates planetary boundaries the most? I bet some of you would say China and some would say the USA. Well, I hate it when Malaysia leads in bad things. But this is the current situation. This is very up to date. You can look at the website. It's performed by Leeds University, and you can look at it and compare it on a regular basis. So we have really violated a lot of our planetary boundaries. Now, if you violate the planetary boundaries, then you are going to actually impact your economy because it's all correlated. It will impact health. It will impact human behaviors. It will impact also, who's going to work and how they're going to go to work. So here's a very clever woman in the photo, and it's not me, and her name is Kate Rayworth, and she's a dear friend of mine, and she works at Oxford University. Kate was is an economist, and she worked at Oxfam, and she realized that you can't end poverty the way we look at economics. So she challenged current economic theory. She challenged this notion of GDP, and she then developed this concept: how does the economy actually work, and how does the economy and the environment, interplay? And using these planetary health boundaries as well that I mentioned before. And basically, they're not mutually exclusive. If you protect the environment, you protect the economy. If you don't protect the environment, you don't protect the economy. And therefore, she developed this thing called the Donut Economic Framework. And if you haven't read her book yet, go out and grab one because it's so fascinating. And what she says is that if you look at the whole economic model as a donut, I guess the Dunkin' Donut type, not the fluffy ones we get sometimes in the Pasar Malam. But if you actually violate your boundaries, which are the outer ring, your hole gets bigger. And then more people will fall into the hole. That's basically the concept of donut economics. So this is why it's really important. Now, when we had COVID, this happened. Global daily emissions fell, right? We saw suddenly KL had clear skies. We could actually see stars at night sometimes. So this huge dip on carbon emissions over the past few months has reached actually 2010 levels. And there are no cars roaming around at the time of MCO. Plants and factories were shut down. But we shouldn't romanticize these environmental benefits, right? This is not the kind of decarbonization we want. This is temporary. It is an acute onset. It's not sustainable. So decarbonization through a pandemic that is circulating a virus around the world is not a good option because it marginalizes and kills people. What we need is decarbonization that is gradual, that is planned and intentional, that does not kill people and takes into account the negative. So consequences, right? Especially for those who are poor, because that could have an impact as well. Unfortunately, as we speak here today, there are still many other hazards out there. Malaysia has been quite lucky in the sense that we are sheltered by Indonesia and Philippines. So in all my speeches, I say Philippines is a supermarket of disasters and Indonesia is a 7-Eleven. We are still the Kudai Runcit. So we are lucky in that sense, but it will hit us. Maybe not as the impact that they experience, but we will get it. And we have seen this. More severe flooding, more severe flash flooding and urban flooding as a result of more rain and poor, sometimes drainage and planning and rapid urbanization. So I think that, what I want to say to you is that these things are not going to stop just because there's a pandemic. Hang on a minute, let's deal with one crisis at another. We will have compounding crises as well. What about the human resources? Now, earlier there was a great discussion about, the real life stories about what happens to people during this pandemic. You and I have heard it, we have heard anecdotes, but we've also heard real life, experiences. I get so many messages in my WhatsApp from friends I have not met for a long time telling me how difficult it is, right? And, thankfully we have, Prihatin and Prinjana now, which is really helpful. And I think what HRDF has, your role right now is so critical. It's about the upskilling, right? Because we can't look at jobs with the same lens that we have that is today's jobs. What are future jobs? Therefore, if you're going to upskill, what are you upskilling to? If we take into account that the world has to be more decarbonized, has to be more environmentally protected, what kind of jobs are we looking at? How does all this come together, right? And I want to specifically mention women because, is anyone from Department of Statistics here? Okay. You can tell them that I said this. But, so they did a presentation, I'm a member of the Economic Action Council, and I said, so where is the sex and age desegregation? Because people always assume it's uniform. Right? The HR impact, men and women the same. It's not the same. It's not the same. Because women, unfortunately, have to do the cooking at home during the COVID pandemic and MCO. They have to make sure the children study online. They have to do all these things on top of keeping their job. And not only that, sometimes the immune systems and the health systems are both overstretched. We've seen, like we look at sexual gender-based violence, for example. The police IGP tells me, the numbers are not rising. And I said, well, are you surprised? How do you complain when your husband's sitting next to you? We haven't built systems that protect women, right? We haven't built systems that if a Grab driver comes and I do this, then you should know that I'm actually being abused. There's no thinking around how we protect people, including children. So I think that, one of the things, I'm a trained obstetrician and gynecologist. So one of the good things for my profession is I think there'll be more pregnancies at the end of this year, deliveries. Because a lot of women, particularly in remote areas, did not have access to sexual reproductive health tools, including contraception and so forth. So these are real issues that women face. I think as a human resource, I guess, topic, if everyone's going to get pregnant at the same time, it's a big problem for you. So I think that, we've got to think about the gender perspectives, not just women, but also people with disabilities, differently able and so forth. Now, just now I heard Dr. Nelson mention about mental health issues, and they are real, right? Apart from the stories we hear about suicide, and it's a huge mistake to criminalize suicide, in my opinion. So I think there is a move to really, engage the government on decriminalizing this. It's not a health issue, it's also about security. Now, I think that mental health is that hidden epidemic. The biggest problem with mental health issues is stigmatization. Right? When you tell people you have a mental health issue, they think you're crazy. Actually, it's not. Mental health issues range in a lot of this. Which of us in this room have not suffered stress? Right? All of us have in some way or other. Now, this has been a study and was produced in Asia One, and it was monitoring the phone calls to the call center in Ministry of Health in the early days of MCO. And it found that 46.8% were linked to emotional problems such as stress, anxiety, and anger. That's high, right? Added to that, there were 20% just worried about the disease. So the disease plus the mental health is about 60%. I think that's a significant number. Now, what about opportunities now? I think that COVID is a real opportunity for us to press that reset button, to rethink, how we at a personal level are going to behave. How do we at a community level and at a national level as well? So I think the future of work from home is one of those things we have to really think about seriously. You would have seen that Google, Facebook, all these people have already decided that they're going to work from home from now. Now, that's not only going to help people go to work, but how does that impact the commercial space industry, right? The businesses that are renting spaces and so forth. How does it affect your connectivity to work and all that? So this was a really nice article that Jeffrey Chia was interviewed. And I think that, even in Malaysia, 83% are considering working from home options post-MCO. And 54% are considering work from home for people with disabilities, which is great. And 43% are considering working from home for caregivers. Now, I think that, this tells us that we need to see how then, do you ensure corporate resilience in light of working from home measures and so on and so forth. And, how do we actually train managers to not micromanage when people work from home? I think there's all sorts of tools now that you can actually spy on your staff, whether they're really working, right? You can do all these things, but I think that doesn't work. I think we have to think about, what might be useful in terms of how we monitor working from home. I have been managing many of my teams remotely in the last 10 years, and I'm very flexible about working from home. The only thing is I set very clear goals and I make sure that they meet it. We catch up once in a while, and I think my teams have just overperformed generally. I think that one of the things that came out of this study is that the pandemic has forced so many organizations and companies to make working from home work. And it's shown that it is possible. And the second thing is that actually most employees surveys actually want to do working from home on a more regular basis. Not constantly, but some of them still feel that they want to do that. And of course, there are also, the downsides of working from home, because to build teams, sometimes you really do need contact. So I think this is where, companies need to be very innovative in how they actually build those teams and allow for contact. And it can be outdoor contact or whatever. And, the COVID virus will end one day, but there might be a COVID-20, yeah? Don't forget. So my call is that, this is Jeffrey, sorry. Right. I think my clarion call to many people is that we've got to start looking at everything we do through the lens of ESG, which is environment, social and governance levels. Whether it's corporate level, government level, we have no choice, because I think this is really important. I'm really happy Securities Commission in 2019 produced the Sustainability and Responsible Investment Roadmap. I was involved in that when I was in Geneva, and really looking at how do we actually stimulate growth in Malaysia while not foregoing all these different factors. And I think there's many good examples where this has worked. And you look at the situation, you're in Sweden, you've been following that. They don't even have any more trash because they're so good at recycling, right? How do we make a business out of upcycling and so on and so forth? So I think there's so many different opportunities that are out there. And of course, in light with all this, Malaysia is really moving towards a digital vision. And we've heard this from the Prime Minister himself, from the Economic Action Council. How do you have a digital vision for Malaysia? And I think that digital economy has been the backbone and stabilizer of the COVID-19 era that we're all going through right now. And I think it's a blessing in disguise for our digital economy. I think that, you've seen e-commerce platforms growing rapidly. All of us are now Shopee addicts for some reason. There's something that you just have to get at Shopee. And I think that it will be that stabilizer effect, right? No. Oh, this should have come earlier, but it's okay. I'll move forward. So I'm going to now say that, yes, it's fine. We want to have a digital vision. We want to get people to work from home. You have to make sure you're connected. But the reality is that we still have a digital divide in this country, and that is actually very, very apparent the further out you go from KL. And digital economy contributes about now 18% of Malaysia's GDP, right? So I think that we have to look at, and I think this is where the focus of the government as well is to really look at, how do we close that digital divide? How do we ensure that, when you have a middle income family, and I completely agree with Dr. Nelson, the middle income trap, right, is the one, the M40 trap. And they have only one Wi-Fi provider, maybe one cell phone, no iPad, nothing. You have 5 children who want to learn. So it's a real challenge for this. So I'm trying to keep within my time. So the Earth's capacity is not negotiable. And I think that unlike healthcare systems capacity, which is good in Malaysia, planetary boundaries cannot be altered. And once you damage it for good, most likely. So our global systems are just not ready for the other waves, which are larger than COVID, and that is climate change and biodiversity collapse. And those will also have health impacts at all levels, whether it is at the personal level, community level, and so forth. It can also have some irreversible effects as well. And the other thing, of course, is that there are different pathways that it can affect health, whether it's climate change or biodiversity collapse. Malaysia is a rapidly aging society. It's also a society that is declining in fertility. So we will be heading to a situation where we have a lot of old people, less young people. And as I tell my children, better implant an RFID under my skin if you have no time to take care of me, so that it's monitored on your iPhone and in case I don't move, and that it's also connected to a clinic so that they can know if I'm not well. I mean, this is a society. So there are many things we need to think about. The workplace, the communities that you're living in, right? If you're going into business now, I would suggest you go into elderly care business. If you're in the housing business, I would suggest that every condominium has an elderly care center. So these are the things you need to think about, the opportunities there as well. I'm going to end with asking you some difficult questions maybe to think about. Are there enough environment experts, or what I will call planetary experts, right? Or planetary scientists embedded in organizations? Is this one area of human resource that we really are lacking? And I would say yes. In this hotel, I was thirsty, so I had to drink. But normally I bring my own water because I refuse to drink from a plastic bottle. How many of you go back to your offices and see plastic bottles in your office? Right? I'm on the board of a university here, and the last meeting I went, I refused to drink, and they said, why? I said, because you have a plastic bottle. Very happy to say I was in a board meeting virtually just now. We've replaced it all with glass bottles. So it is possible. It is possible, and you don't do this because you're a tree hugger. I'm not. But because I worry about my health, I worry about my future health, my children's health, my environment, my country, and future jobs. So this is really, really everyone's business. What is your commitment to a better better country, a better world, right? It has to start from an individual. There's no realization and there's no, you don't take this seriously, then your company will never take it seriously. So it's very important. So the second thing is, I'm going to ask is Malaysia ready to take the bold step of implementing a 4-day work week? In light of what we have seen with COVID-19, one of the worst hits industries is tourism. So if we have 4-day work weeks, it may be longer hours in the first 4 days, and we have everything digitalized and everything that we can do work. Maybe if you give people a 4-day work week, the ones who are on the M40 and the B40 can perhaps do something over the weekend to be more enterprising, to earn more income. The ones who have more money can take short breaks and holidays around the country, fill your hotels, fill your tourist spots. But I think the critical word we need to talk about is, do we trust each other to be able to actually look at working from home and other options for work in the future of work in a lens that is suitable for the 21st century? Or do we want to conform to the very old clock in, clock out and very, bureaucratic processes of HR? So trust is going to be key. And I think to build that trust, you have to be clear on your vision, your deliverables, your implementations, and then be accountable. I think that will build that trust. So I hope that, I've given you not too dark a picture of the world right now, but I wanted to give you a realistic view of what's going on and to drive home the message that COVID-19 will go. But there will be other challenges that we have waiting for us, if not already happening around us. Thank you very much for listening. Thank you.